Welcome back, everyone. Thank you for just hanging on momentarily. We have our second panel, which is going to take a look at the Middle East and over in South Asia. As I mentioned at the start of our first panel, this is really an excellent way to show how the Wilson Center and why we are the #1 regional studies think tank in the world as rated on the think tank surveys. And really this ability to show this global perspective. So we're going to move over into the Eastern Hemisphere now, and we're going to we'll start with Marina Ottawa, and she is a Middle East fellow here at the Wilson Center and a longtime analyst of political transformations in Africa, the Balkans, and the Middle East. She's working on a project at the Wilson Center about the countries of the Arab Spring and Iraq. She joined the Wilson Center after 14 years at the Carnegie Endowment for International Peace, where she played a central role in launching the Middle East program. And prior to that, she carried out research in Africa and the Middle East for many years and taught at Georgetown University, the Johns Hopkins School for Advanced International Studies, the American University in Cairo, the University of Witwatersrand in South Africa, and the University of Zambia, and has done extensive research, and it's reflected in her many publications, which include 9 authored books and 6 edited ones. Marina, so happy to have you to join us today to talk about what's going on in the Middle East with some of these non-state actors and terrorist groups. So please, take it away.
Thank you. The issue in the Middle East, as we all know, I think the Middle East is beset by a number of active wars. I was listening in on the previous panel, and a lot of it was about crime and cyber crime and so on. The problem in the Middle East is wars. And the question is whether the spreading of the virus is how the spreading of the virus is affecting the wars that are going on. Is it making it likely for that the United States will de-escalate its presence there as it had started doing? I'm going to talk about 3 sets of actors. I know the focus is non-state actors, but I think it's important to talk about the state actors. So I'll talk about the states very briefly. I'll talk about the violent non-state actors, but also I want to talk about the peaceful non-state actors, in this case, the protesters who have been trying to change the character of some of the Arab regimes and have played a very important role in the last few years. So first of all, the state actors. And by and large, if I can generalize, the state actors have been the more conscious of the danger that war entails in terms of spreading the coronavirus, have been a bit more careful about committing troops. Even the United States has started pulling out, not just of the coronavirus, but certainly in part of it, has started pulling troops out of some of the outposts in Iraq, not pulling out of Iraq, but certainly are concentrating on a smaller number of bases. And certainly there is a cautious that you see on the part of the United States in committing troops. By and large, it is states have been trying to protect their troops. But that does, in the Middle East at this point, it does not necessarily mean a decrease in the level of conflict, because many states are using mercenaries rather than their own people in these conflicts. Turkey is very committed, is very invested in Libya at this point. But there are no Turkish troops in Libya, at least not in any significant number that I know of. Most of the people fighting for Turkey in Libya are Syrians. And the same is true about the battle around Idlib within Syria itself. These are Syrians that have become displaced Syrians that were refugees and have become mercenaries for Turkey. You have the same situation all over, essentially. Even even Iran, that's using its own people, the Quds forces and so on, is also turning to a number of mercenary, troops from other countries that it hires to fight in Syria. So the general rule that we see state actors being more cautious about engaging in conflict because of the virus and the threat to their troops is tempered by the fact that they can continue the conflict by using troops, people from other countries. That Russia is relying very much on troops that are not its own troops and so on. And so that is changing, that's a change in the calculus, I think, for a lot of state actors. And it's important to keep in mind. The United States, of course, it's not using mercenaries at this point, not on a large scale. I mean, and we don't call them mercenaries, but we are not as dependent on security firms as some of these other countries are. So there is definitely, you can see a greater cautious on the part of the United States to engage in conflict. For example, before, in January, whenever there was an attack by Iraqi militias, they launched some missiles on a US base or outpost. There was immediately a reaction by the United States. Since March, that has slowed down. We are not anxious to get more involved. Now, the big problem is the violent non-state actors, because for the violent non-state actors, the virus has been seen more of an opportunity than a hindrance. In one of its publications in May, ISIS made the point explicitly, now it's the time to hit. Now it's the time to escalate our actions. And because countries are distracted by governments are distracted by the issue of the coronavirus, are afraid of committing troops in this situation, and therefore this is the time to strike. And I think there is beginning to be quite a bit of evidence that this is happening at this point. I wrote something on this about a month ago, and at that point it was not quite clear to me that ISIS was following up on the threat. I think it's becoming clearer that it's following up on the threat. There have been many more incidents both in Iraq and in Syria about ISIS attacks, and pretty much all over not just in one area. So clearly ISIS is trying to take advantage of this. The other conflict that has probably not escalated, but certainly has not decreased because of the coronavirus pandemic, is Yemen. Things in Yemen are as bad as they have ever been. And they have been pretty bad all along, because now, in addition to the fighting that has already created an epidemic of cholera and has already created a very high level of starvation, or at least extreme malnutrition, because for a large part of the population, access to food is non-existent. And keep in mind that in Yemen, access to food is very dicey, even in normal times, because this is a country that does not produce sufficient food, and it uses a lot of the land and water where it could produce food crops to produce khat, this drug. It's a bush, and people chew the leaves, and it's mildly narcotic things, and it's kind of a national pastime in Yemen, and that unfortunately diverts both land and water from the production of food crops, and makes the problem of food accessibility even worse for a country that is very poor to begin with. So the conflict is not decreasing. The Houthi rebels who occupied Sana'a there are two governments in Yemen, and there have been for a long time. I don't want to go into details, but essentially there is the Houthi rebels that have occupied the capital city and claim to be the government, and then there is a government in exile or the sort of hold up in the south of Yemen that is supported by the Saudis and until recently the United Arab Emirates. And the fighting between the two sides is continuing, and there is tremendous concern on the part of the United Nations, for example. They really don't know how they are going to be able, in the situation of continuing fighting, the epidemic raging, because the medical care is practically inexistent, and therefore there is no way to control this epidemic. They really don't know how they are going to continue to deliver help to the civilian population. So these are two conflicts that really have not abated. I mentioned briefly before the conflict in Libya, which is perhaps abating a little because the mercenary and planes sent by Turkey are beginning to make it more difficult for General Haftar to continue the fighting against international recognized government. But it's a question of winning and losing rather than a question of saying, oh my God, we cannot continue the war under these conditions. The other group that I want to mention, and in terms of how they are affected by the epidemics, are the non-violent state actors. And this is very important. You know that in 2011, there was a big wave of uprisings throughout the Arab world. But most importantly, more to the point right now, is that there was a second wave that started in 2019. And it was particularly important in 4 countries, and I'll talk particularly of Algeria, the Sudan, and Lebanon, and Iraq, actually. Let me talk about all 4 countries. And these are uprisings. We know that the uprisings have had a lot of impact in the 2011 uprisings had a lot of impact before, not necessarily the impact that people expected, that the protesters in the street expected, but certainly have led to a lot of change. Now there is the new wave of uprising was still going on when the virus broke out. They have not come to an end. They have not come to any sort of conclusions. To some extent, they have had a positive effect in the Sudan, and there are not many demonstrations in Sudan and protests in the Sudan by the time the virus, the break of virus. The problem is now that the government that was formed after the uprisings, with the participation of the civilians, various civilians groups that had participated, is now sorely tested. So it creates yet another obstacle, essentially, to the success of this government, which is a government that in many ways deserves to succeed because it's so much better than the one that preceded it. The problem is that the country has no resources. The country has, the health system is a disaster and so on, so that this government does not really have anything to protect the population, so that it's, by definition, it's not going to make a good showing in terms of the way it reacts to the coronavirus, because it has nothing to do it with. So it creates another degree of uncertainty in a country that already has a lot of uncertainties. In the other 3 countries, that is in Algeria, Lebanon, and Iraq, the demonstrations were still ongoing at the time the pandemic broke out. And let me talk about Iraq first, because in Iraq, for a while, like everybody else, the protesters in Iraq went back and forth. First tried to minimize and saying we are going to continue no matter what. Then they decided that this was really too risky and they pulled back from the squares. The government did not stop arresting people and sending them to jail. It's now clear that they have arrested a very large number of people. And when that continued, then the demonstrators started going back to the squares. We don't have any data, not that I have seen, about the level, how that has increased the number of infections. I don't think we have sufficiently good statistics to compare the cities where demonstrations are taking place to the rest of the country. But what we see is that the reaction of the protesters is saying we have to continue no matter what. Algeria was a very interesting case because in Algeria, the Hirak, the movement, the protest movement, essentially, has decided to be wise in terms of the contagion. The demonstrators are no longer on the streets, but what they have started doing instead, they are using the networks that they had created to try to deliver some support to the civilian population. So that, for example, some of the parts of the movements are doing food distributions. Rather than marching in the streets the way they did, they are trying to do something directly to help the population. How this is going to translate into what happens next, it's difficult to tell, but it's interesting to notice that this kind of reaction and saying we cannot, this is not the time to march in the streets, but we still are going to make our presence felt, and we are going to make our presence felt by sort of try to help other people. The last country I want to mention is Lebanon. In Lebanon, again, you have a two-part, two types of consequences. The first one was that the demonstrators that had been around off and on for months, essentially, have pretty much withdrawn from the streets. These were young, the usual thing, the young people, and the demonstrations were kind of happy demonstrations, if I can call it that way, people who, define the government, but not in a nasty way. Those have pretty much disappeared. What is happening now, and we have seen that particularly in Tripoli, in the north, is Tripoli, Lebanon, not Tripoli, Libya. But there is new people are starting to demonstrate, and they are very different crowd from the one before. People who are taking to the streets now are people who really are suffering because of the pandemic. Pandemic has hit Lebanon at a time when it was already in a very deep economic crisis. And there are a lot of people who are literally starving. And what you are seeing now, beginning in Tripoli, but also spreading a little bit, a very different type of crowds are taking to the streets. People who are not, the students and the young people and so on, but essentially workers and people who don't have food for their family. And there is very definitely a radical tone, a tone of class warfare to this. How far it's going to go, I cannot tell. It's just beginning, but certainly it could change the situation and increase the level of conflict. And let me stop there.
Thank you, Marina. One question: what is the state of our intelligence on these groups during this time? I think we just had the panel looking at Latin America, and we had an expert talking about Russia. We generally seem to have a lot of intelligence in those areas. How are we with some of these groups in the Middle East?
Well, the United States has been trying to reduce its presence in the Middle East. President Trump has, he tried to get totally out of Syria, then he was convinced to stay in there, then he's reducing the number of troops, then he said, no, they are going to stay. But it's quite clear that the United States is not deeply committed to the Middle East. I don't have any specific information about our intelligence there at this point. I think our intelligence, particularly, I don't think we have probably much intelligence in Syria. Our intelligence in Iraq has been pretty bad from the beginning. We have been surprised by what was happening over and over again because we don't have too much on the ground. I think in Yemen, we rely more on Saudi Arabia and the United Arab Emirates, which has its own limitations and so on. So I think I would argue that in the case of Iraq, not only we do not have necessarily good intelligence, but we have been deluding ourselves about how to interpret the information we have. The United States has claimed to have much more influence in Iraq than it actually has had. The United States has never admitted that in competition for the influence in Iraq, Iran has always had the upper hand, and the United States has been a second there.
Or you may send it to, if you have any questions, you can also send it to congressional relations at wilsoncenter.org, or you can tweet them at the Wilson Center. I'm going to switch over to our next panelist here, which is Michael Kudamon. Pull up the bio here. Yeah. Michael Kudamon is currently our Deputy Director at the Asia Program. He's a Senior Associate for South Asia as well at the Wilson Center. He's a leading specialist on Afghanistan, India, Pakistan, and their relations with the United States. He is the editor or co-editor of 11 books. He has written for the New York Times, Foreign Policy, Foreign Affairs, and other publications covering topics ranging from the U.S. policy in Afghanistan to terrorism, to water, to energy, and food security in the region. So very happy to have you with us, Michael Kudamon. What's going on in South Asia?
Well, thank you for having me, Aaron. Really important and a very interesting discussion we've been having. Thanks for making me a part of it. So what I'll do in my brief comments is just talk about how this pandemic has impacted the Taliban in Afghanistan. And in answering this question, it's important to make a key distinction between the Taliban and other Islamist militant groups in broader South Asia and the Middle East, such as the ones that Marina had discussed earlier, groups like Al-Qaeda or ISIS. There's a key distinction to be made here. The Taliban, unlike Al-Qaeda or ISIS, is not only about causing fear and terror by maiming and murdering. It does plenty of that, but that's not all it does. The Taliban is an anti-state insurgency, and like most insurgencies, like most national insurgencies, it aims to try to win hearts and minds from the local population in order to draw away support from a state that it seeks to undermine and in due course overthrow. So for years, the Taliban in Afghanistan has actually pitched itself in its published propaganda and direct appeals to local communities as a better alternative to the Afghan government, a movement that can provide basic services and better governance, including healthcare, than the corrupt and hapless and feckless regimes in Kabul. And indeed, the Taliban has set up shadow states in some rural areas of Afghanistan, especially those areas that it controls, where it provides basic services, security, justice, and so on. So to this question of what COVID-19 means for the Taliban, my main assertion is that the coronavirus poses a small challenge for the Taliban, but it offers a much larger opportunity. And let me explain what I mean with two observations. First, COVID certainly poses a challenge to the Taliban insurgency. There's reason to fear that the coronavirus is hitting Afghanistan quite hard, given Afghanistan's proximity to hard-hit countries like Iran and China, given Afghanistan's woeful public health sector, and given its high levels of poverty and illiteracy, and so on. So Taliban fighters are just as vulnerable to the coronavirus as the wider population. And Taliban fighters spend a lot of time in close quarters, they share supplies, and they're generally not social distancing type folks. The total Taliban force size is about 50 or 60,000 strong. And if a sizable portion of them were to get the virus, there could be notable battlefield implications. And also the timing of the pandemic, which coincides with the onset of the annual spring fighting season for the Taliban, could potentially be problematic for the Taliban's battlefield plans. But I would not overstate this challenge that the coronavirus poses to the Taliban's fight. The Taliban may be just as susceptible to the pandemic as anyone else in Afghanistan, and its fighters could well get hit hard. But it's important to keep in mind just how strong and confident and emboldened the Taliban is. This is a group that controls more territory than at any time during the US-led war, which has now been nearly 19 years. This is a group that has pushed back really hard against beleaguered Afghan counterinsurgency forces that are also vulnerable to the virus. And above all, the Taliban is a group that knows that US forces are on their way out. There's a lot going its way, and it's just a strong force. So I would argue that the Taliban, even if it suffers some losses from the pandemic, it's going to remain a formidable fighting force. And just consider that the onset of this pandemic over the last few months has coincided with some of the most intense fighting we've seen in Afghanistan for quite some time. And ever since the US government and the Taliban concluded an agreement in late February that was meant to set in motion formal peace talks between the Afghan government and the Taliban, the insurgents have launched a series of offensives against Afghan forces, and they've carried out some horrific terror attacks as well. ISIS has as well, for that matter. Things have gotten so tense in recent days in Afghanistan that earlier this month, after an incredibly savage attack on a maternity ward in Kabul that no one claimed responsibility for, the president of Afghanistan, Ashraf Ghani, announced that Afghan forces were launching a new offensive against the Taliban. And in recent days, nearly 2/3 of Afghanistan's provinces had experienced active fighting. One of the big disappointments for many, though it really shouldn't be a surprise, is that after the UN Secretary General issued an appeal for armed anti-state groups around the world to lay down arms because of the pandemic, hardly any of them did. And that's no surprise. For a group like the Taliban, the deployment of violence and the intensification of that violence is a powerful tool of leverage, and it's not going to easily give it up. And especially now with the very strong possibility of future talks with the Afghan government, it wants to strengthen its future bargaining position as much as possible by inflicting as much damage as possible on Afghan security forces so that you get an intimidated Afghan government in a position to be willing to make major concessions at the negotiating table in potential talks. Now, of course, as I'm sure you all know, just reading the headlines in recent days, the Taliban happily did just recently, on Saturday, I believe, it announced a unilateral 3-day ceasefire that the Afghan government quickly reciprocated. But this is a very brief ceasefire. It's 3 days. Today is the third day. There are rumors and hopes that it will be extended to 7 days. Many in Afghanistan, of course, would like it to be extended more. But it is a short-term ceasefire, and it is not at all connected to the pandemic. It is meant to coincide with the Eid holiday. And this is something that the Taliban also did back in 2018, where it declared a brief truce that it did not continue. So the pandemic did not have any impact on the Taliban's decision to announce this very brief truce. My second observation to get at this point that the pandemic poses a small challenge for the Taliban, but it provides an even bigger opportunity, is that the COVID, I would argue, presents a very useful propaganda opportunity for the Taliban. And here, remember what I said earlier about the Taliban playing the hearts and minds game. It's very interesting that ever since the pandemic broke out, the Taliban's public messaging has emphasized repeatedly its concern about the pandemic, its determination to help keep people healthy, and its assurances that health workers in Afghanistan will be given access to Taliban-controlled areas to do their work. So last week, Mullah Akhundzada, who's the supreme leader of the Taliban, he released his annual Eid message. And the Eid message goes into considerable detail about coronavirus and Akhundzada's thinking on it. So let me just quote a few relevant passages because it's very interesting. So he says, quote, "Coronavirus is a global pandemic. To control the aforementioned disease, the Health Commission of the Islamic Emirate," the Islamic Emirate is what the Taliban formally calls itself, "the Health Commission of the Islamic Emirate has been instructed to exert efforts to the best of their abilities by providing medical facilities to the people and not sparing anything at their disposal. Our advice to the general public is that they also pay close attention to all legal and medical measures to protect themselves from this disease so that, God forbid, no harm touches them. We call on all international health organizations and NGOs to aid our countrymen even further in combating this disease and to provide them with all the necessary tools available. The Islamic Emirate stands ready to provide every type of assistance to NGOs in the transfer and transparent distribution of aid material." Keep in mind, until relatively recently, the Taliban was not allowing NGOs to operate in areas that the Taliban controlled. Different story we're hearing now. Now that message is geared, I think, at both a domestic and a foreign audience. For a domestic audience, this type of messaging enables the Taliban to play that hearts and minds game and try to project itself as a better emergency responder than the Afghan government, particularly when it comes to responding to the health, to the coronavirus. For an international audience, this messaging enables the Taliban to try to position itself as a responsible player, an actor, in anticipation of potential peace talks with the Afghan government that the US government and other key players have sought to help broker. And I think this is especially important given that much of the international community does not trust the Taliban, and for good reason, given its very violent track record. Now, back in early April, it's very interesting, several villagers in Taliban-controlled areas told international media outlets that Taliban fighters were inviting villagers to a workshop after Friday prayers, and at this workshop, you had Taliban fighters that were standing there with their AK-47 slung over their shoulders while they were wearing PPE equipment. Who knows where they got this equipment? Wearing PPE equipment and talking about how to fend off the coronavirus by wearing gloves, washing your hands, wearing masks, and so on. And the Taliban passed around pictures of this messaging on social media, passed around pictures of this on social media as well. So basically, you know, the Afghan government, the Afghan Taliban, as part of this propaganda effort to cast itself as a reasonable, responsible player fighting the coronavirus, as part of that effort, the Afghan Taliban was essentially channeling its Anthony Fauci impulses. Now, it is a fairly common thing for Islamist militants in broader South Asia and the Middle East, for that matter, to step in as emergency responders during humanitarian disasters, especially when governments lack the capacity to do so. One of the most prominent examples in South Asia would be Jamaat-ud-Dawa, a Pakistani extremist group tied to Lashkar-e-Taiba, the terror group that staged the Mumbai, India terror attacks in 2008. So back in 2005, Jamaat-ud-Dawa sent several thousand of its members across Pakistan-administered Kashmir to help with recovery efforts after a huge and deadly earthquake. And sometimes terror groups even incorporate these health emergencies into their wider grievances. So a few years ago, there were widespread electricity outages during a record-breaking deadly heat wave in the Pakistani city of Karachi. And the Pakistani Taliban, which is a different group from the Taliban in Afghanistan, that group threatened to bomb the public power utility in Karachi if it did not restore power. To wrap up, though, I'll just say this. During the coronavirus, most terror groups in South Asia, aside from the Afghan Taliban, have been quiet and have not really said much about the pandemic. And I think there's several reasons for this. One is that due to robust counterterrorism operations in the region, there are not that many groups at the moment that are making a lot of noise in general. And two of the groups that are quite potent and active, other than the Taliban in South Asia, groups like ISIS, they have no interest in bringing attention to the coronavirus, as it's essentially immaterial to their cause. And third, the Taliban, as I've just laid out, has a particularly strong incentive to engage the coronavirus, to engage on the coronavirus issue, given the propaganda value that the Taliban believes it gets from doing so. So to conclude, very simple assertion, the coronavirus I think will help the Taliban a lot more than it hurts the Taliban. And with that, I will conclude. Thank you.
That's very interesting. I think you bring it out well, trying to win hearts and minds, and so here they are coming in as the reasonable actor. They try to look. They're portraying themselves as reasonable actors, and is this an effective recruitment tool when you've seen this happen in other humanitarian crises?
Well, I mean, it depends on the case. Certainly, I referred briefly to the Pakistan example, where you had that extremist group that was providing relief during that horrific earthquake in Kashmir in 2005. A group like Jamaat-ul-Dawa is able to gain legitimacy, or at the least, public support from many, simply because it's doing things like that. When in a country like Pakistan, government forces have often struggled to be out there, out front, delivering aid quickly. It's essentially the army. The army is doing it, which has much more capacity than the civilian government. But you have these extremist actors that fill the gap, and certainly I'm sure Marina could speak for similar cases in the Middle East, if you want to talk about a Hezbollah or a Hamas or a group like that could provide that type of service. This has worked in the Pakistan context, and in the Afghanistan context with the Taliban, the government in Afghanistan has been so unpopular. Successive governments that have been in office since the Taliban was overthrown in 2001, incredibly unpopular, and unfortunately, the Taliban has been able to use that unpopularity and grievances of so many Afghans toward their government. The Taliban has been able to channel that in a way that they could actually attract public support. For instance, policing, local policing. Policing outside of Kabul is generally outsourced to some pretty unsavory actors in Afghanistan, and they oftentimes don't provide local security. They terrorize local populations, and the Taliban has been able to step in and say, well, look, we can do it better. It's not the only reason why the Taliban is in the position it's in now, but it certainly is a factor. And given that it controls a fair amount of territory in Afghanistan at this point, it's able to replicate that and provide that types of basic services, sort of the role of a shadow state that I described earlier. And of course, this unfortunately only helps its cause in this insurgency.
Marina, what are you seeing? Don't forget to unmute yourself there, Marina.
Okay. I thought you were in charge of unmuting me. There are very strong parallels. I totally agree that Islamist groups, both violent and non-violent, have a long history of delivering social services. It's part of their ethos, if you want. In the Muslim Brotherhood in Egypt, that contrary to many claims was not a terrorist organization, it was a radical organization, but it was certainly not a terrorist organization, was running a very important network of local clinics for years. That was always, and they made a point of treating everybody, including Christians. It was a heart and mind strategy. They were, and I would argue that it is the groups that see themselves as a potential future government that are more inclined to do this, to deliver social services to the best of their capacity. It would be very interesting to know what ISIS would have done if it still controlled territory. Given the character of ISIS, I suspect that they would have shut down the areas under their control completely. Not necessarily in a benign way, but because they were not benign people. But I suspect that they would have given strict orders to stay home. At this point, they don't have territory. It's all hit and run attacks that they. So there is certainly no delivery of services, no attempts to show what they can do. But all these movements that see themselves, Hezbollah is very important. Hezbollah has been delivering the help to the Shia population of Lebanon for a very long time. They reconstructed South Beirut after 2006, for example. They were getting money from Iran, but so they had the money that they could use, but they certainly made a point of bringing help to the population. So I totally agree with Michael on this.
We also had a question, and Michael, this may go to you. We had a question on, wildlife trade, flora fauna trade, which may not be in your wheelhouse, but it does raise the question of the illicit trade that does come from the region, particularly if you think about heroin and the drug trade coming in from that region of the world. Could you speak to that a little bit and how that's been affected?
Yeah, absolutely. And I think this question of drug trade during the pandemic is an important one because in the South Asia context, at least, you have a number of key countries, India, Pakistan, obviously Afghanistan, as well as some Central Asian states, plus Russia, that are struggling through some pretty significant heroin epidemics. And a lot of that heroin is sourced from Afghanistan. The Taliban derives a fair share of its profits from drugs. I mean, it derives its profits from a variety of places, not just drugs, but drugs are a key source of that revenue. And one thing that's been, somewhat predictable is that the flourishing drug trade has not slowed down during the pandemic. And you could talk about how a number of countries, including Afghanistan, have tried to call for these lockdowns to shut down the country so that there's more of an opportunity to fight the pandemic. Very hard to enforce that in Afghanistan, particularly when the writ of the state doesn't oftentimes extend that far beyond Kabul, and local officials struggle to do so even more. But in the context of drugs, Afghanistan is a very poor country, and you have large numbers of poor farmers that have long grown poppy because they see it as a fairly profitable thing to do. And they also get a lot of pressure, if not threats, from the Taliban to keep doing it. And that's, as I understand it, how things have continued to play out during the pandemic, that the Taliban may be stating in its propaganda that, oh, we're going to do everything we can to help fight this epidemic. But they're certainly not encouraging, I'm quite sure they're not encouraging poppy farmers to stop growing poppy. And likewise, the drug trade has not been that impacted. Certainly, there have been some border crossings that have been shut down to try to fight the epidemic, particularly the Afghanistan-Pakistan border. But as you know, I mean, so much of the drug trade it's done informally through smuggling, and it's not transiting the main official border posts that have been shut down. So unfortunately, one of the many troubling consequences of the pandemic in the Afghanistan context, when thinking about non-state actors, violent non-state actors, is that the Taliban's main source of revenue continues to pile in. The drug trade continues to take place as it had been prior to the pandemic.
Structuring, and what do you see as occurring to the Taliban, I guess, with the peace deals and things like that, given that senior leadership are in the age demographic of those being the most susceptible to COVID-19?
So I missed the first part of your question, but I believe you basically said what could be the impact of the coronavirus on the Taliban, given the age of the senior leadership. Was that your point? What
changes in leadership or organizational structuring could you foresee for the Taliban given that situation?
Well, I'm not sure. I think it's a bit too early to tell, and it is notable that in recent years the Taliban has seen a younger leadership Kabul that's a younger leadership cohort that's come out. So you have a lot of younger faces within the Taliban, including on high levels. But I don't know of any shifts or organizational changes that the Taliban has undertaken, though of course it's too early to know. Again, it really depends on how much this virus impacts the Taliban on the whole. And as I mentioned earlier, there's a good chance that you could have a number of Taliban fighters, or even those higher up, that get the virus. But this is a group that, unfortunately has shown a very strong ability to replenish fighters that are lost in battle. And they've lost many, many fighters in battle in the 19 years that U.S. forces have been there. So, I think in that regard, it's perfectly easy to replenish. I don't think they're necessarily thinking about organizational changes or anything like that because of the threat of the coronavirus pandemic. They're in a position to replenish fighters just because their recruitment efforts have remained quite robust during the years of the war, and certainly over the last few years as well.
Go ahead, Marina.
Yeah, I wanted to point out that there is an endless supply of fighters, not only in Afghanistan, but throughout the Middle East, because you have a young population and no jobs, and fewer and fewer jobs given the situation. So it's fighting is a means of survival, and joining the Taliban or joining ISIS or joining any of these other groups is a means of survival, and we are not likely to see the recruits dry up because of the pandemic, because it's almost a choice between starving and risking becoming infected by going and fighting.
That's why I did want to ask that of you, Marina, in regards to ISIS. How are they with getting foreign fighters? Is there any slowdown in people being able to travel to places like Syria or Iraq to join the fighting? Is that a logistical problem that they make?
I have not heard of foreign fighters playing a particularly important role now. There are probably still foreign fighters who never got out before, but I think most of the recruitment is local. Keep in mind that they don't, operating as they do now, that is causing, going into an area, burning the crops or killing people and then getting out. They don't need a whole lot of people. They are no longer an occupation force, the way they were in the days of the caliphate. So that recruiting does not seem to be a problem.
Well, I want to thank both Michael and Marina for joining us for this second panel, and I want to thank our first panelists, Duncan Wood, Eric Olson, and Louise Shelley. Also want to thank Congresswoman Jane Harman for her support in this endeavor, and Rob Litvak for doing the introduction, and all the folks that in our audiovisual team that were on the back end here, really making this run smoothly. They've just been amazing at getting our events to go into the virtual space. We're doing a lot of events at the Wilson Center virtually, so you can go to wilsoncenter.org/events to see all of those. And we're doing a lot of webcasts, and all of this is still available to everybody. And of course, I mentioned some podcasts. Michael Kudamon has a podcast that he works on with the AFPAC file, is what it's called. You can find our podcasts on iTunes if you search for the Wilson Center. You can also find them on the Wilson Center website as well. So appreciate everyone who's joined us today, and appreciate all of our panelists and everyone at the Wilson Center who helped make this happen. And we will see you the next time we do one of these events. Thank you.
Thank you.
Thank you.